you're at Google News, and I am Melanie Santos, here to inform you about what you should know in case of a biohazard attack. Here is the head administrator of the LA Hazmat Unit, Gloria Ann. So, Gloria Ann, can you please tell Marilla something about yourself?
I'm 35 years old, married, and have a lively 3-year-old son. I started in law enforcement and volunteered in the fire department in dedication to my community.
So, Gloria Ann, what kind of materials do you work with, and aren't you scared in coming in contact with the hazardous materials?
Yes, it is a very risky job, but if I wear the appropriate and necessary safety gear, I'll feel safe enough. I trained in handling hazardous materials like lead, asbestos, radiation contaminant, and toxic spills. I remove and clean up the hazardous materials that are found or spilled and comply with safety procedures and federal laws regarding waste disposal.
So, Glo, are you the first to recognize the bioterror attack, and what team should be called in, and what type of action should be used upon their arrival?
Yes, I am part of the first responder awareness unit with the hazmat. The teams that should be called in are the toxicologists, physicians, the hazmat team, and the EMS if necessary. The type of action that should be used upon arrival is that the hazard should be identified, assess the situation, obtain the necessary help, and respond accordingly. Above all, we should not assume that gases and vapors are harmless, because odorless gases and vapors can be harmful. Empty containers should be handled with caution, because they may still be hazardous.
Gloria Ann, how did you come involved with the hazmat unit?
I was asked to assist the hazmat unit to investigate an environmental crime involving a toxic spill 6 years ago. I was impressed with the courage and professionalism of the hazmat unit and decided to leave law enforcement.
Certainly, you've seen these labels on chemical containers, but you may not have understood exactly what the colors and numbers mean. Well, let's take 2 or 3 minutes to clear it up and explain this particular labeling method. A suggested method for identifying hazardous material containers is the Modified National Fire Protection Association system. The NFPA method, which is used in addition to the original container label, provides quick recognition in an emergency. The NFPA utilizes a diamond-shaped warning symbol which has 4 sections, usually color-coded. The left diamond signifies the health section, coded blue. The top diamond is the flammability rating, coded red, and the right diamond is the reactivity signal, coded yellow. The bottom diamond is colored white and contains special symbols indicating properties and categories not explained by the other sections. The rating systems within each section are numbered from 0 to 4, ranging from least dangerous to extremely dangerous. In addition, OSHA and the National Institute for Occupational Safety and Health have indicated that the scale caution, warning, and danger is appropriate for warning labels. If both of these warnings are to be placed on a container, the word danger would cover any diamond which had at least 1, 3, or 4 rating. Warning would cover any diamond which had at least 1, 2 rating, and caution would appear with diamonds having nothing greater than a 1 rating. If the NFPA diamond is used and workers are properly instructed in its use, the other system is probably unnecessary.
So now we have Nicole, who is a manager within the hazmat unit. So Nicole, what approaches can be used to clean up an anthrax bioterror attack? And do you know any methods and effectiveness with these type of situations?
Well, many hours of preparation help fast response times to approach any situation that we may come across. With the extensive training, we are able to eliminate minimal exposures or injuries to our employees. Crews and supervisors will take safety measures to ensure a safe work site.
So, Nicole, what protective measures should the hazmat committee use for a portable anthrax bioterror attack?
Protective gear should include overalls, gloves, shoe covers, safety glasses or goggles, and sometimes fully enclosed protective suits. And extreme toxic cleanup hazmat workers are required to wear respirators to protect themselves from airborne particles and noxious gases. Lead abatement workers wear a personal air monitor that measures an amount of lead to which the workers have been exposed.
Anthrax is one of the most threatening and contagious diseases going on today in which hazmat is trying to control. So now we have Dr. Francisco, who is a doctor at USC Hospital who specializes in microbiology. She will give us an extensive explanation on what anthrax is, the signs and symptoms if infected, and the different kinds. So Dr. Francisco, what is anthrax and what are 3 modes of anthrax infection?
Anthrax is caused by the bacterium Bacillus anthracis and can exist in 2 forms, an active growing cell or as a dormant spore. These spores are hard to eliminate and are tolerant to extreme temperatures, ultraviolet light, and humidity. They can survive for a long period of time, even up to decades, without any source of water and nutrients. When a spore enters the body of a mammal or a host, it germinates into a vegetative cell that can cause disease to the host. Once it finds a place rich with sugars, amino acids, and water, it attacks. So there are 3 forms of naturally occurring human anthrax infection, either through ingestion, inhalation, and through the skin. Gastrointestinal anthrax typically happens when you eat the meat of the animals infected with B. anthracis. The person's intestinal tract, mouth, or throat may be infected. Inhalational anthrax is the result of breathing in B. anthracis spores into the lungs. Inhalational infection is the form of anthrax that would be of most concern. Cutaneous anthrax can happen if spores enter the body through small breaks in the skin. It accounts for approximately 95% of all reported human anthrax cases.
Within the 3 modes of anthrax infection, what are the symptoms of each one?
Now, the signs and symptoms of inhalational anthrax will show within 2 days to 6 weeks and can experience fevers, headaches, and muscle aches. And if left untreated, this can lead to shortness of breath, chest discomfort, and even death. This can also lead to enlargement and bleeding of the lymph nodes and bloody collections around the lungs, and can be seen in chest imaging. The fatality rate is 90% if left untreated. If someone so happens to ingest the anthrax infection, signs and symptoms can appear within 1 to 6 days following exposure and can possibly experience a fever, ulcers in the back of the mouth and throat, sore throat, difficulty swallowing, and swollen lymph nodes and neck. A person can also experience nausea and vomiting, bloody diarrhea, abdominal pain, and even shock. The lethality rate is more than 40%. So if you have an infection through the skin, signs and symptoms can show within 1 to 12 days following exposure. Small sores are seen at the infection site, which can develop into a blister, then into a painless ulcer covered by a black scab. Swelling can be seen around the ulcers as well. Death rate is about 1% if treated with antibiotics and 20% if left untreated.
Dr. Francisco, what type of treatment is recommended for anthrax?
A 60-day course of an antibiotic such as ciprofloxacin or doxycycline is done. Treatment is most effective when started as soon as possible. Which antibiotic or combination of antibiotics depends on what type of anthrax the person has, as far as their age, overall health, and other factors. However, some cases of anthrax respond to antibiotics. Advanced inhalation anthrax may not. By the later stages of disease, bacteria have often produced more toxins than drugs can eliminate.
Dr. Francisco, besides humans being exposed, are protective measures necessary when working with animals?
Of course, proper gear should be worn, but if animals are exposed, antibiotics should be given to those animals that are infected.
Thank you for listening to Team Google News. Once again, I am Melanie Santos, and hopefully this informed news brought your attention to a possible bioterror attack.
Oh, sorry.
Clean up an anthrax bioterror. Who is the manager within the house?
Risky job, but if I wear the appropriate necessaries, the toxic top. Yes, I am part of the first responder awareness unit. Oh, they're on. What?